to get started. If you could just mute yourself, that would be helpful. So good afternoon and welcome to our Wednesday coffee chat with elder care attorney Robert Slutsky. And we have our special guest that we're welcoming today, Dr. Robert Pearlstein, and he is from Suburban Geriatrics. And he's going to talk to us today about COVID. He's going to offer some information to us about the COVID virus, about the vaccine, and he's going to offer tips to us for caregivers and for healthcare professionals and how we can be a better support system for other people during this difficult time. So we invite you, after Dr. Pearlstein shares some information, we invite you to ask questions. You can mute yourself and ask them freely, or you can also use the sidebar to have a little chat and we'll bring them to his attention. And he prefers to be called Rob, very casually, right, Dr. Pearlstein?
Yes.
Okay, so go ahead, Rob, and you can share a little more information about yourself and about your practice as well.
Okay. Welcome everyone on a beautiful Wednesday afternoon. So today we're going to talk a little bit about the coronavirus and a lot of the stuff that comes with the coronavirus. And obviously vaccine is on everyone's mind. I am a geriatrician. I take care of older people. I take care of them in my office. I take care of them doing house calls. We do a lot of nursing home work. We do a lot of assisted living work. I work with Rob Slutsky a lot when it comes to the county. When we have people that are living in the county that are not doing well, the county calls him for the legal stuff. They call me for the medical stuff. I've been around forever, it seems like. I've gotten old doing this job, and I guess I have a lot of experience. And I guess as the years have gone by, I've done more teaching and a little bit more stuff like this. I work with the county on preparation and preparedness when it comes to the vaccine and how we're going to distribute it. So I guess I kind of, over time, have developed a lot of the, I guess, outlets and places and people that I've met to know a lot about what's going on. So I think that the thing to start with is, let's just talk about the coronavirus in general. What is it? The coronavirus is a virus. I'm sure everyone's heard of the word novel before, and novel just means it is a new strain of coronavirus. The virus that we're dealing with is called COVID-19. And the question is, how'd they get the word COVID-19? Where did that come from? And actually, it's pretty simple. The CO in COVID is for corona. The VI in COVID is for virus. The D is for disease. So it's corona, virus, disease. 19 was its year 2019. So that's how we got coronavirus. Question always, haven't we had coronaviruses in the past? The word is absolutely. Coronaviruses have been around forever. And usually up until this pandemic, the coronavirus was no more than a common cold. And when we get common colds, we don't really test for it. In the last, I guess, 15 to 20 years, we test for the influenza or the flu. We don't test for coronaviruses because they don't make people that sick, and it's not that, it is contagious, but not that contagious. People then ask, in 1918, which was our last pandemic, was that a coronavirus? The answer is no. That was an influenza virus. That was closer to what we do for the flu shot, or why we give the flu shot is for the influenza. And again, that was a strain of influenza that we had a hard time treating. And back in 1918 was before antibiotics. We had no treatment. And unfortunately, millions of people from that pandemic.
I'm sorry. Wait a minute. You're who? Yeah.
All right, I'll keep moving. So, a lot of things about this virus. So, obviously, everyone's heard that in Wuhan, China, it was first found probably in December. What this virus is known for is its ability to spread. It spreads very, very easily. which is why so many people have gotten it. Now we're up to 20 million plus people have the virus. Fortunately, it can be very, very, it can make people very, very sick. But fortunately for us, it could be worse. Only about 10% of the people that get the virus get very sick. About a third of the people have zero symptoms, which is one of the scary parts of this, because people are giving it to other people, and they're giving it to other people, and they're not realizing that they're walking around with it, which is why we're so obsessed with wearing a mask, social distancing, washing our hands, because of the spread. I happen to work in nursing homes and assisted livings, and unfortunately, as everyone's heard, the facilities have had very poor response, and partly because you put together 100, 120 older folks with pre-morbid conditions and pre-existing conditions like high blood pressure and diabetes and dementia, it spreads like wildfire. And as much as we try with all of our PPE, which is gowns and glasses and gloves, it still unfortunately can be spread, because not everyone does everything perfectly. So,
Bye-bye.
The nursing homes have had a very difficult time of this. I will say, though, since March, when we first started dealing with it, we deal with it much better, and our results are much better. In the amount of people that are passing is a lot less than it was in March when we first started dealing with this. There are many treatments out there for the virus. Everyone's heard of, remdesivir and plasma and antibodies. And these are all different things we can use depending on how sick someone is. And that is important because it depends where people get sick, how they get sick, and where they're being treated. It's like I said, it's been changing almost dramatically. Every month we learn more and what would be the best way to treat. Right now, we are at the worst of this pandemic than we've been. And part of the reason is the sheer numbers of people that have coronavirus. It's not that it's any stronger than it used to be. The strains that are coming out are a little bit more contagious, but they are not causing more death. The problem right now is just more people are getting the virus. And the more people that get it, that means the more, if 10% of a lot is more than 10% of a little. And we're seeing the hospitals fill up. I'm associated with Einstein, Suburban, and Phoenixville, and all three hospitals are full, and about a third of the patients in the hospital are there because of coronavirus. So, at this point, we're not doing very well. Before we get into the vaccine, does anyone have any questions about coronavirus itself?
Hi there.
Actually do. Oh, sorry.
No, it's okay. It's Hercules Botman. I just want to, has anything changed in terms of younger people getting it with more consequences?
The answer to that is yes and no. The answer is we're seeing a lot more young people get sick, but again, it comes down to the numbers. It's still a percentage of the people that get the coronavirus. It's still the same thing. It's just we have so many more people getting sick. Older people are being much smarter than they were in March. We're taking a lot more serious. So there's less, so more younger people are actually getting the disease because they're a little bit cocky. They think that they're invincible. And so younger people are getting it and younger people are getting sick. But again, it's a percentage of the people that, percentage of people that get coronavirus get very sick. With younger people, there's a difference. With older folks, when people get coronavirus, the biggest problem is lungs. You get a bad pneumonia, and the pneumonia is on both sides. That makes, and an older person doesn't have the reserve, so they don't do well. When younger people get the virus, they're not actually dying from the virus. They're dying from the problems associated with the virus, such as a blood clot to the brain, blood clot to the lungs. These are secondary issues. If everyone remembers the actor from Broadway that died, that was healthy in his 30s, he didn't die actually of coronavirus. I mean, he died because of it, but he died from complications caused from coronavirus. That's where younger people are having more problems than they did. Well, it's just we have more people getting it that are younger, so we're seeing more of those problems associated with it. So the answer is yes and no. Plus, our treatment's a little bit better, which is, again, let's go back to one of the treatments is, and I still get calls to use hydrochloroquine. And hydrochloroquine does help a little bit. But what we were finding in younger people, it was causing a lot more deaths because of the other issues with the COVID virus. Not the virus itself, but the secondary issues had problems. And that's why the death rate on people using hydrochloroquine was higher than the average people. So I hope that answers your question.
That's very good. Thank you very much.
You know what, Rob? I have one.
Yes.
So on the pre-existing condition, what are you finding, or are people generally finding that certain pre-existing conditions are more likely to lead to, bad outcomes, bad problems with their lungs, since that seems to be the biggest problem?
The answer is yes. And I will tell you that the two biggest pre-existing conditions we have problems with, actually three. One is age. And unfortunately, you can't control that. Age is a major factor here. Lung issues are a big factor because the problem is you get pneumonia. And people with lung problems prior do not do well with pneumonia. Obesity has a big problem because the heavier you are, the less lung reserve you do with breathing. And when that happens, it causes, you get a restriction in your breathing. So if you go into respiratory failure, needing like a machine, then, your outcome is poor. People with diabetes and hypertension and poor diet, they all add to this, but are not directly causing worse outcomes, if that makes sense.
I had a question. You had said earlier that it's so dangerous because people that can be asymptomatic can still spread it. There seems to be still this, I don't know if it's a misconception. I actually had words with a loved one I'm concerned about last night because she said, oh, well, the person wasn't symptomatic when they were around me, so I can't get it. So is it true that you can still pass it if you're asymptomatic? Because that's what I told her. I said, you got to watch it. You're immunosuppressed.
Not only are you right, a person that's asymptomatic has the exact same amount of spreadability, that's a word, as someone that is symptomatic. Because fortunately, some people have an ability to take a virus and not have symptoms. Doesn't mean you don't have the virus. It just means you don't have the symptoms. Your body is internally fighting it. But if you have the virus, you could spread it. Even though you don't have symptoms, you still have the virus. And that is a major problem. And especially the amount of young people, and I'll call young people 18 to 30, the amount of young people that are asymptomatic is close to 75%. So you're talking all of our college kids. You're talking about all these young people that feel invincible. And they also don't really, as my kids, I call them dumb. They just do dumb stuff. And it's hard to get through to them. So yes, that's where the big problem is. And when you look at the numbers right now, and one of the things we're scared about is older people over the last 3-4 months have been really good. My patients really have been great. But we just had Christmas and the holidays. And what happened? We were good. And then all the kids came in for the holidays. That is what we're worrying about right now. Because that window from the 24th of December to the 1st, 2nd of January is going to hit us now. And that's what we're scared about. Because an older person that really shielded themselves All it takes is one exposure. And that's what's scary. And that's why, if you've noticed, there's been more, we're talking more and more about hospitalization, because that's the secondary issue. The more people that get it, the bigger amount of people that get sick enough to be in the hospital, the less hospital beds there are. And we are right there right now. And we're in Norristown, and we're not in one of the bad places. I mean, we're in the average place, and it's getting bad. So your answer is yes, the spreadability is exactly the same.
Where are you located?
I'm in Plymouth Meeting.
Okay.
But as a practice, we're all over the place because we do a lot. We're more of a traveling group.
Well, I'm in Harleysville, so I'm not far from you.
No, and we go to the Birches, which is in Harleysville. We go to a lot of facilities in that area.
So Rob, I have a question for you. After recovering, what are the most likely future morbidities that are going to be a result of damage done by COVID that you believe?
That is a great question. And I have to tell you, it's a very scary question. What we're worried about post-COVID. Now, someone does, I have a lot of people that recovered from COVID. A lot of people. The pneumonia you get with COVID is so unique that in my 25 years, I've never seen anything like it. The worry is that the younger population, and I'm going to call the younger population 45 to 60, that ended up in the hospital with this bilateral pneumonia. We are worried that 5 years down the road, the amount of people with chronic lung disease is going to quadruple. That all these people that, yes, they did well, yes, they're home, yes, they feel like they recovered, are going to have this chronic lung condition. Other than that, we're really not seeing anything that looks like will be a problem going into the future.
I've got
Dr.
another
Rob?
question.
Yeah, I had a question. I just wanted to know a little bit about the clinical protocols and how do they differ for patients being admitted directly to the hospital?
That's a great question. And every hospital does it a little bit differently.
Yeah.
When this thing was blowing up in March and April, which is the first phase, we'll call it, us as hospital personnel were scared to death. We didn't know what we were doing. I mean, all we knew is we wanted to stay away like someone that had the flu. And we would dress up and we did all our PPE. We learned a lot since then because we have a lot of statistics. And one of the concerns was, if enough nurses get sick, who's going to take care of patients? Right. So the protocol in the beginning was overdone. Overdone, undressing in between patients. I mean, it was really unbelievable. What we found is, honestly, if you wear gloves, you wear a mask, you wash your hands, and you be smart, that's really the most important thing. I see, since March, I have seen at least a couple COVID positive patients every single day. And I am not obsessive. I wear my gloves, I wear my glasses, I wear a mask. And I've been checked 44 times. I've had a test and I've been negative every time. And I'm with them every single day. And I have 2 kids in their 20s. So, but the point is, healthcare workers don't get it if they're smart. Mm-hmm. It's sitting around a lunch table with 6 people without masks is where you have a problem. So PPE is a little bit of a problem, and there are definite protocols. And the protocols are really being logically smart. I wear a mask literally 90% of the time. Even, I go and sit outside at a restaurant and I wear my mask unless I'm actually eating. Why not? That's how I look at it. Now, getting back to your question about protocols. So the protocols are a lot less than they were. The protocols are not as stringent in the sense of the amount of stuff I have to wear that it was in March. Because we now know that healthcare workers actually are the least to get this. And we're working with them all the time. And they found that the healthcare workers that do get it are getting it when they go home. They're not getting it from the floors. So there are a lot of protocols about how we have to wash our hands, and we have to change gloves, and we wear either masks or goggles or something like that. But and the nursing homes are the same way. The problem in a nursing home is you're dealing with 23-year-old nurses' aides that are not necessarily the brightest or educated or committed. And all it takes is one to do something wrong, and all of a sudden we now have a spread. So the protocols have actually been defined and redefined and redefined. And I think that things have gotten a lot better in the last couple months than they were in the beginning, because we just didn't know. Do you have any specific questions that I didn't answer?
I do. I understand that I'm in group, 1A or 1B. I'm 78 years old. I'll be 79. And like I said, I had a sudden cardiac arrest 8 years ago, and now I'm getting this spinal cord stimulator on January 29th. So is it a fact that I am in group 1A?
You should get the vaccine, and everyone that is on this thing, the sooner you can get it, the better. And we're going to talk about that. That's the second part of this talk.
You're going to give us steps to do to get it?
I'm going to talk to you. I'm going to explain exactly what they're doing and how they're giving it out in the whole bit.
And what we can do, right?
Yes.
Okay. Thank you, Doctor.
Paula, so did you have a follow-up there?
Yes, I did. In terms of looking at the inpatient hospital stay, are there any challenges in terms of treatment protocols at this point? Are hospitals running short of certain medications and treatment? I'm concerned about that right now as well.
And I watch CNN a lot, so I hear what you're saying. I'm in 3 hospitals. The 3 hospitals that I go to, we have none. We have full PPE, and these are 3 hospitals from 3 different hospital chains, and we have no problems with PPE. We have no problem with protocol. We don't have laying in hallways and stuff like that. We're full, but we're not over full, and I've not seen it. There's plenty of remdesivir. There's plenty of plasma.
That's what I was wondering.
We have not seen it. Now, I have seen in LA County, they're having major issues. I've seen in pockets of the country. I don't know why. I don't think that my 3 hospitals are special. I don't think that they're, you know what I mean? Like University of Pennsylvania is special. They have whatever they want. Suburban General in Norristown's not special, so they have plenty of stuff. So I'm not seeing that. I think a big problem that hospitals are having is employee issues. The hospitals aren't used to being full. We're full. So it's taking more man hours to maintain the hospital. And because of the protocols, you can't take because you don't want someone taking care of 5 COVID patients and 3 non-COVID. So we're isolating. So we're really needing more people. I would say that is probably a bigger problem than the PPE/medication problem.
Thank you very much.
Can I ask you which hospitals you are in?
I'm at Einstein in Norristown. I'm at Phoenixville in Phoenixville, and Suburban General in Norristown.
Okay, well, my surgery is going to be at Abington main campus.
Good hospital.
Good.
I have another question that kind of piggybacks on the chronic lung disease that you're anticipating a little bit more problematic in the future. I'm hearing a lot of people saying that they have cardio issues post-COVID recovery. Do you feel like that is something down the road that we're going to see a problematic rise in?
No.
Okay.
Because the good thing about the heart's a muscle, and the heart pumps, right? So unless the heart develops a cardiomyopathy, meaning a fat heart, during it won't be a problem later. The problem with the lungs is there's actually damage happening during the pneumonia. Viruses can cause a heart problem. It happens in a percentage of people. It's not a big percentage, it's very small. But viral cardiomyopathy is actually something that happens. And I think that the same percentage of people that it happens in the community every year, it will happen with this virus. But I don't think it's anything. This virus will not cause coronary disease, will not cause those type of problems. So we're hoping the answer is no.
We have a question. we have a question about pulmonary fibrosis. Is that person that has pulmonary fibrosis more sensitive, one, to the coronavirus, and two, can they still be treated with the vaccine?
Yes. The answer is yes, you have to get the vaccine. It doesn't cause corona. None of these conditions cause it. It unfortunately, people that have it don't do as well. So, and yes, there is no one, and we'll talk about that should not be getting the vaccine.
Rob, we have a few questions from the chat that I would like for you to address.
Sure.
Somebody asked, once you have COVID and recover, do you have immunity? And how long does the immunity last?
Well, the first part is you're immune. The second part is we have no idea, which is why everyone needs the vaccine. And we're going to talk about why that is. You want me to go, let me talk about the vaccine now for a little bit, and then we'll go back to questions.
Okay, sure.
So let's talk about the vaccine. I want to talk first. There's so much misinformation out there. Let me try to explain what this vaccine is. This vaccine was started 8 years ago. This is not a new vaccine. It's an 8-year-old vaccine. And it was a brilliant idea that's going to change healthcare. It's called messenger RNA. And if everyone remembers back to high school, RNA are how our body produces everything. That's our body makeup is RNA. So there was a great idea 8 to 10 years ago that the RNA produces proteins. Why can't we build perfect proteins? And about 10 different companies around the world said, that is a brilliant idea. We're all going for it. So for 7 years, 8, 10, 12 companies all were doing independent work on this idea. COVID comes out in December, comes out in January. The world starts to really have issues on February. And it was decided through the world community that we're going to put our heads together, and all these brilliant people from all these different companies are going to put their head together and are going to finish this vaccine. So what was started 8 years ago, all these brilliant people across the world put their head together and finished this vaccine. So anyone that thinks that this was thrown together overnight is wrong. So what they did was they finished it, and it was about 80% done before the coronavirus, and now it's 100% done. So they figured out a way that they actually can make perfect antibodies, that will fight this coronavirus. So whereas when you get coronavirus, you build antibodies, okay? The body is building to this infection that it has, but it doesn't know exactly what it's building. So it produces these antibodies, and it gets produced for a month, maybe a couple months, and that's what's floating around your body to fight it if it comes back. Well, so the answer to your question was, how long does it last? No one knows. We don't even know if those antibodies are good. We just know that there's antibodies there. And when people get tested, they get antibody tested. We don't know how many. We don't know how good they are. Well, with mRNA, we're building. So mRNA makes proteins. Proteins make antibodies. So we are able to give you a vaccine that has no virus in it. It has this RNA. It's almost like a little bit of an architecture. It puts it in your body, and all of a sudden it builds these antibodies that are perfect. And they're perfect because they last a long time. And they last, and they build up a certain amount. And that's why the vaccine is so successful. It's very interesting if you really look at the data. When Pfizer and Moderna, the first two came out, very interesting that the data is exactly the same. Do you know why? Because they are the same. Because everyone put their heads together and made a vaccine. The hard part was, so they all have the vaccine, but now they all have to put it in something to put it into your arm. It's called the matrix. Everyone's matrix is different. Pfizer was the first, and they knew that it would be easy to get to market, but it had to be really cold. Okay? They knew that they were going to be the first, but they also knew that by the time the next 4 or 5 came out, they're going to be obsolete. But they wanted to get out as fast as possible. Moderna, on the other hand, figured out a way to put this vaccine and where it wasn't as cold. The next 2, Johnson & Johnson and AstraZeneca, don't even need to be made cold, and they're probably only 1 shot. So the vaccines, the actual vaccine, are almost all exactly the same. So our data will be the same. It's how it's distributed within your body. It's how the matrix that they put the vaccine in gets in you. That's the only thing that's different. So when people say, can I have the Moderna or the Pfizer? Doesn't matter. They're the same vaccine. Okay? So how safe is this? Well, because this vaccine is totally geared to only hit one thing, it doesn't have stuff that's going to react with the rest of your body, which is why it's very, very specific, and it doesn't really have side effects per se. And we'll talk about side effects. And the side effects are nuisance side effects. They're not bad side effects. The old vaccines, you were actually getting the vaccine. They actually took virus, put it into a petri dish, built more vaccine and antibodies, and then that's what you got. So the body thought that you were getting the vaccine and would build up antibodies. So there was a lot more ways to get reactions in that situation, where this one there's not. The side effects of the vaccine are the one that people hear about, and actually, interestingly enough, the first week we had 3 people, and since then I have not heard one. There is some anaphylaxis. What is that? It just means you have a reaction to the vaccine. Actually, they didn't react to the vaccine. They reacted to the matrix, what the vaccine was made in. So it wasn't the vaccine that they had a problem with. All of those people were given an EpiPen shot and were fine, didn't stay in the hospital. They were good in 15 minutes. So that's why everyone, when they get the vaccine, have to sit for 15 minutes and wait. In our area, we've had no problems. I've had a couple people that got nauseous. I've had a couple people that had a headache for 24 hours. Definitely a sore arm. Expect a sore arm. I just got the second vaccine last week, and I got it on Thursday, fine Friday, and I missed Saturday because I slept the whole day through. So for whatever reason, that was the side effect, and if that's all it is, it's fine. So we really haven't seen, the data has really, and over about 10 million people have gotten in the United States. So we've really shown to have real good from a side effect profile, which people are scared about. I understand, but that's safe. Safety. Who is not safe for it? Well, the American Academy of OBGYN came out this week and now recommended it for everybody, every female, whether they're pregnant, 2 weeks pregnant, or 38 weeks pregnant. If they came out and showed the data how safe it is, it's safe. And there's not really anyone that it's not safe for. Children, because they needed to get this thing through the FDA, when they started the studies, Pfizer specifically, they did it 18 and over. They just didn't have time to do a lot more with the kids. Moderna is 16 and over. AstraZeneca is going to be 12 and over. So it's safe, but they just don't have the data to support it. They will have the data. We'll have the data for all of this because we now have more time. And that's what you're going to see. So the great question, Robert, I'm going to answer your question about where you're getting the vaccine.
Yes.
So the federal government released X amount of vaccines. So the state of Pennsylvania got 3 million vaccine. The problem was there was no federal guidelines. There were recommendations on what to do, but there was actually no infrastructure in the states. So they handed them 3 million, and the states kind of said, "Oh, we'll give them to the hospitals. Now what?" And that's where we're sitting right now in Pennsylvania. And I can't tell you, every state is a little bit different on how they're doing it. So the good news is the hospitals got theirs first. They were the ones that got it first, and they vaccinated most of the people associated with the hospital. Up until Friday, all the nursing homes got their first shots. And that's in nursing home, the patients that live in the nursing homes as well as the employees. Starting Monday, all the assisted livings and the assisted living employees will be getting it. Now, what I've seen is because of all the negative publicity that there's a lot of extra shots out there, the state has panicked a little bit. And if you've noticed, there's been a lot of advertising about different sites that are going to be available. They're opening the convention center. And there's Rite Aid, CVS, Walgreens are getting more shots. They will all be giving it. They are going to start by giving it to people that are in healthcare, first responders, and people over 75.
Okay.
So, Robert, I think you're over 75.
I'm 79 almost.
Perfect. So you need to keep your eye on it. The doctor's offices will get the shots eventually, but probably not until AstraZeneca or Johnson & Johnson's shot come out. So we probably won't get it until March. But right now, you need to keep on Montgomery County's website. And they will come out and you will be able to get on a list to give it. Montgomery County Community College, I know, is one of the first places to start doing mass vaccinations, and they are giving them. They were for first responders, but they're going to open it up in the next week or so to older folks. So that's where you need to get on the site. Unfortunately, it's got to be done through the computer. So if you're not great with the computer, make sure one of your children or one of your friends that is on top of it, because it's first come, first serve. I think, though, what I've seen and what I'm hearing is over the next 2-3 weeks, we're going to have a huge influx of vaccines. It's going to run out, but there's going to be, whether it's 500,000 or 1 million vaccines through the state are going to come out pretty quickly. And then we're going to end up having a little bit of a delay until the next group comes out.
Should
Yes.
you try to get on one of those sites, especially if you have a lung disease?
Not especially, definitely. Ms. Hayes, do it today. Sign up as soon as you can.
Is that the
No,
Montgomery County website, or the Montgomery County,
the Montgomery County Health Department or Montgomery County will have a link to go. It will get you to the health department.
Okay.
And
Yes,
but
last night Rite Aid had appointments, so I have my significant other and he and his friends got on because they're older than I am. Then I got on, told my date of birth, and I was 62, so I wasn't allowed. But that Rite Aid does have it, and I'll forward that to Heather, and she can get it out to you. It was in Northeast Philadelphia, was the closest place we could go. So on Rising Sun Avenue was the Rite Aid. So I'm going to just forward it to Heather, and she'll get it out to you, Robert, and then you'll be able to click right on. It was pretty easy, except I failed.
Thank you,
Epic fail.
Mary. Heather, you
I'm
have,
happy to send this out as a follow-up from today. I will send out that information. Absolutely.
you have my email, right?
Yes. Yes, I do.
Thank
my
you.
one concern with the Rite Aid, and everyone I know has signed up for Rite Aid. I'm a little wary of Rite Aid. They weren't supposed to get that many vaccines, and they are giving them out by the thousands. So, and I haven't seen anyone get it yet. So I would, if you see anywhere to sign up, I would sign up in 2 places. Just cancel it if you get, as soon as you get the one, it doesn't matter where you get it. The sooner you can get it, the better.
Okay.
So, when it comes to the vaccine, the good thing is that once we're vaccinated, that really helps things, because it helps it in 2 ways. Technically, if you can't get it, then you can't spread it, right? So that's,
Right.
So that's where, when you hear about herd immunity, you're talking about getting enough people so that it won't spread because no one's going to get it. And we need to get to that point. And I'm just as bad. I mean, it's a bummer I have to still wear a mask, but until we have more data, we're still wearing a mask, and we're still being smart, and we're still doing everything we can to keep any possibility of spread.
What is the efficacy of the vaccine?
Upwards of 96%.
Good.
Yeah, it's remarkable.
Hey, Rob, I heard from a doctor yesterday who was saying that after you get the vaccine, you can still be a carrier. Now, is that because you already have it in you, or can you still be a carrier after you've been vaccinated? I mean, that didn't make sense to me, what he said.
Yeah. And all right, so some of that is semantics. When you hear some of these doctors talk, they're really talking in different, they use words that really mean different things. So the one thing about the vaccine is I got the Pfizer, so mine's 3 weeks apart. So I get the first vaccine, and at 3 weeks, I'm about 60% efficacy. 2 weeks after my 2 second vaccine, I will be 96% good.
Okay.
At that point, is it possible to be a carrier? Yes. Is it probable? No. But we're in a situation now that we want no one to be a carrier. So it really depends on in what context someone's saying that. So, and the other thing is we don't totally know. I mean, these are things that we're going to know as time goes. We're going to know more and more and more about what is possible or not possible. But at this point, I think that the message is that please stay safe, whether you have the vaccine or not.
Hi, Rob. Thank you for that. Arthur and Hung here. We're actually here for our parents, and we're concerned about COVID and everything, but it also has us wondering about financials as well. They're currently on Medicare and Medicaid. The only asset is their home, and we're wondering, as healthcare professionals, sometimes we hear patients worry about putting the house on the line or something of that sort. Is there any situation where their house would be on the line for some reason to pay for long-term care or medical services or anything of the sort?
Mr. Slutsky, I think that one's for you.
Well, it really is. But when you say that, I mean, that's a pretty broad question. If they're on Medicare and Medicaid, technically that should cover all of their medical costs. So unless they choose to use an unconventional treatment or a provider that isn't approved through either program, it shouldn't affect them. And my understanding, which is very limited on the COVID side, is that, the COVID vaccines are all being covered by insurance. But again, I don't know that. I don't deal with that. But I can't imagine a circumstance where getting ill, if they're covered under Medicare and Medicaid, should cause them to lose their home. I mean, obviously, if they're getting Medicaid, there's potential estate recovery issues after they die. But as far as currently, no, they should be able to enjoy their home, for the rest of their lives.
What about, I think that's part of the issue. Like when working with patients, they're like, oh, we want to keep the house for our kids, even when we die or something like that. I think that's I guess where it can go with that. I'm not sure.
Well, I mean, again, that's a very client and fact specific case. So there are situations where when we are doing planning that we can work around the estate recovery lien that Pennsylvania, well, every Medicaid agency in the country has it if you want federal matching funds, because it's required under federal law for every state to seek an estate recovery lien. But there are some tools for Pennsylvania residents that we can use to work around that lien. So that, but again, that's very specific to a client and their facts financially and what works for them and the family.
Okay, gotcha. Thank you.
You're
And
welcome.
a point of reference, the vaccine is actually free. The government bought all this vaccine. It's free.
Doc, I have a question related to allergies. If someone has a food allergy, like nuts, example, is that a problem with the vaccine?
No, and that's why we have to sit 15 minutes. Every vaccination site is extreme. That's the one thing we're concerned about, and we are totally. It's easy to treat. So if for some reason you're one of those hyperallergenic people, which, like I said, the first week, 2 people in Alaska and 1 in Washington State had a reaction. I haven't heard of any since, and we're talking 10 million doses. So it's not something very common. There are some people with some bizarre allergies from, internal allergies, but even that, it's easily treated, and they're prepared for that.
Even penicillin allergies.
Even penicillin allergies.
I just wanted to, real quick, if anyone here happens to be in Delaware County, you probably know that we don't have our own health department. I just looked on the website. You can, for those who are healthcare professionals, I just applied, and I guess they sort of triage it. I didn't want to, because I don't do direct interaction with seniors and patients, I didn't want to take a vaccine away from somebody who might really need it. But if you're saying there's access, then why not, right? So I did just apply. It took 2 seconds.
Absolutely.
Thank you, Sarah, for sharing that information. And we do have another question from somebody. Somebody wanted to know if asymptomatic patients have suffered any secondary life-threatening complications later on.
Zero that we know of. Most likely not, because the reason they're asymptomatic is because they've had no negative reaction to the virus. So the answer is probably not.
Thank you.
Oh, we have to have more questions than that. This is an easy one.
My fear is that people are in assisted living and nursing homes, and the people that work there are not willing to take it. What I heard yesterday was about 35% of employees in personal care and assisted living and nursing homes are getting it, and the other people are not ready to get it yet. And that's unnerving a little.
It's very unnerving. And I'll tell you what the true statistics are, that 50%, so the nursing homes did a shrewd thing, or actually CVS thought of this. So they're giving 3 times. They're giving day 1, 3 weeks, 6 weeks. So what we're finding is that 50% of the employees are getting it on the first one. We're finding that another 25%, so 75% of the people on the second one. A lot of people are scared. They're uneducated. They don't really get it. They have a million excuses. But once they see that half the people got it and everyone's fine, then about half those people will get it. Unfortunately, I don't understand why we're not making it mandatory. I don't really understand why we make the flu shot mandatory. Why can't we make this mandatory? But again, that's above my pay grade. But it is concerning. I've done this talk over and over again to try to get people, and it works, because I think people just have questions and no one's there to answer them. And if you ask a friend a question, he tells you what he saw on television instead of the actual right answers. So it just spreads like whisper down the lane.
Rob, we also had a question. If somebody has had shingles, should they wait a certain period of time before they get the vaccine?
No, it has nothing. There's no correlation to anything like that.
Okay.
There's really no reason not to get the vaccine.
Okay. We do have another question. If somebody has ESRD, end-stage renal disease, should they take the vaccine now, or should they wait and see what the typical side effects are? She's concerned that sometimes she has bad side effects when she gets the flu. She has soreness in her arm, fatigue, and sometimes she needs to take time off of work to sleep. Would you have concerns? And she has allergies.
None.
Okay.
None. And I will tell you that it's more important for that person to get the vaccine. Because that person can't afford to get this virus.
Okay.
So the downside of the virus is much, much worse than the vaccine will be.
Rob? Go ahead, Beth.
I have a question. When we had our children and we take them to get vaccinated or inoculated, we'd often get the recommendation that we should give them a couple doses of Tylenol prior to the injection. And I've heard that this is contraindicated in the COVID inoculation because you want an inflammatory response. So they don't want you to take anything to offset potential side effects from the injection. Do you know anything about that?
No, the only thing I would tell you is bring an ice bag.
Okay.
Yeah, I haven't heard that. Again, this is like putting a computer in your body and the computer working. You're not going to manipulate this like you could. A virus itself thinks on its own. It's not programmed. So you don't know how it's going to react, which is why some people get the flu and are really bad, and some people get the flu and are not really bad. This is like a computer telling it what to do. It's building these antibodies and this amount of antibodies in everybody. Whether you take Tylenol or not, it's not going to alter the way this thing works, which is why it's so brilliant. And one more step on this. This new technology is going to be the new technology for everything. We're going to find in cancer that they're going to use this technology to build these antibodies to go after certain cancer cells. They're not there yet, but they're very close. So this is how we're going to be dealing with, whereas right now when we treat cancer, sometimes we treat cells, but it goes to a lot of different areas. And that's why chemotherapy causes damage and stuff like that. Well, this type of thing is very, very specific to what it's doing. And I think that down the road, and hopefully not that far down the road, we're going to start seeing the trials for cancer treatment. And I think that it's probably going to be much better than what we have now.
Praise the Lord.
Yeah.
Yes.
Rob, I've talked to a couple of nurses and a couple of chemists that I know, and they've indicated that they would surely take the Moderna or the Pfizer, but not the other so much. Any thoughts on that? And I forget what the name of the other one is.
Well, there's one it's the next two coming out are AstraZeneca and Johnson & Johnson. They will be the exact vaccine.
Okay.
They really are. They are really the exact vaccine that is just made in a different matrix.
And what are your thoughts about whether or not people can get the virus a second time?
It's a great question. And part of the reason is this came to the United States at the end of February. So we are learning as time goes, and the more time we have, the more we learn. The idea is that you shouldn't be able to get it twice. Why? Because you get an immune response and you get antibodies. The problem is we don't know how long these antibodies last. So the longer we go from February when you potentially could have had it, now we're looking at 11 months later. Could you potentially get it a second time? So technically in the beginning we said no. We're now saying maybe. I will tell you it's not a definite yes. Some of the people that tested positive twice, it's the testing is not accurate. And we're finding that sometimes people that, when you get sick, everyone gets sick differently. So some people get sick and they're really sick for 3 days and then they're fine. Some people get sick, they're not really sick, but it lasts for 3 weeks. That's what viruses do. So some people feel that you can get it in, March, and for some reason in May, you still have virus floating around. So you might have had a negative test in April, but then you have a positive test in May. Does that mean you now have a new disease? Or do you just have the same one that just didn't go away? So there's a lot of thought on it, but it's the answer is it's not a definite yes, you can get it over and over again.
Mm-hmm. Thank you.
So we should go to Montgomery County website.
I would go there, and I would go to Rite Aid.
Okay. Do all of the Rite Aid drugstores have the vaccine?
Well, none of them have given any vaccines yet. They say they do.
Okay.
And we do have some professionals in our presence here today that work with some of the pharmacies, and they have shared that they'll update us when they have the vaccines available.
Yeah, you're going to get updated. The government and Pennsylvania have panicked a little bit because of the negative press they've gotten. So you will see the state give out a lot more vaccines. Any reserves they have, that you're going to see out there. And I have a feeling it's going to be a little bit haphazard how they do it. But that's human nature, and that's how we do things. You know, until there's a better plan in place, you're going to see like places pop up and say, "We got 1,000 shots. This pharmacy has this." So jump on it as soon as you can.
Doctor, my wife is 69 and she's got rheumatoid arthritis. Would she be in group 1A or 1B?
We've kind of abandoned a little bit of that 1A, 1B thing. If I were you, like, as someone said, I think Sarah, that went in that she was not old enough yet, but she wasn't 65. So they might be giving anyone over 65.
Okay.
They're deviating a little bit. So to be honest, I would try to get her the vaccine.
Yeah, it's in clinical remission, thank the Lord. But
that's one. They're not able. When you sign up for these clinical, it's going to be age. They're going to look at your age and be able to say yes, you fit in or not. They're not going to ask you questions like what conditions you have. They can't do that. They might say, "Do you have any conditions?" and you write yes, but they can't be specific.
Okay, that's good.
Another question from the chat is whether or not after you receive the vaccine the second time, can you still be a carrier of the virus to other people if you're exposed to it?
And I kind of answered it before. The answer is not really, but it's a possibility. So we have to err on being safe. Now, 2, 3, 4 weeks after you get your second vaccination, the chance of you being a carrier are very, very small, but it's possible.
Doctor, I was a volunteer at Abington, Jefferson, Lansdale, and but when I went to Grandview, they said they have stopped all volunteers. So I went to my volunteer manager and the manager of the department where I was working, and I just said, I think I'll wait until all of this is over.
Right.
I can just tell you guys that I went on to the Chester County Health Department's website this morning. My husband's 71 and has some underlying conditions, and I'm 65. But in order to fill out the form, there was a drop-down box that, with the categories that fell under 1A or 1B, wherever they are now. So your age had to be 75, and there was no category for, just somebody with an underlying condition unless you, worked in a healthcare setting. So they haven't updated that to be able to go on there and register being 65 and older.
Yeah, and that's exactly right. And unfortunately, so disorganized on a state level that every county and that's why you really have to be good with the internet and go through the county, but also go through Rite Aid or CVS or whoever's offering shots and try to get in there. And they're all interpreting who's getting it a little differently.
So in other words, sign up for 2 or 3 different places, huh?
Well, wherever you get it first, that's great.
I have a friend that's a volunteer director at a hospital, and all of her volunteers got them. So if you call your volunteer director and you were a volunteer on their roster still, there might be a place for you because you have been a volunteer and are willing to go back after your shots are there. So you might want to call back and ask them if they have shots for volunteers.
Okay, thank you.
Mm-hmm.
Yeah. I mean, the hospitals fortunately got a lot of shots, and not everyone got the shots that were, not everyone took it. So there are extra shots at the hospital. They're a little picky on who gets it, but it's still being offered.
If they start giving out shots at a faster pace now, will there be enough to cover people when it's time for the second shot? Using the Moderna or the
places that I deal with are not giving a vaccine unless they have you saved for the second vaccine. And I know that there is a push right now to start over vaccinating and not worrying about the second shot. That hasn't happened yet. And that's something that some people are starting to talk about. But at this point, what I know is that anyone that's gotten a shot has a secured second shot.
Do you schedule it when you have your first shot? Do you schedule it at that time, the second shot?
Yes, because it's a certain amount of days later. So most of the places that wherever you sign up, if you get Moderna, it'll be 4 weeks. If you get the Pfizer, it's 3 weeks later.
I used to work for Pfizer.
There you go. Call them.
I don't even know if they remember me.
Well, thank you so much, Dr. Pearlstein, for joining us today for this coffee chat. This has been a real treat to have your expert knowledge and experience to be able to share with us some of the information about the COVID and the vaccine. And we're grateful for that. And certainly we are grateful that we can be a resource to everybody in the community. And I think that there were plenty of healthcare professionals on here and families as well that will definitely benefit from having your knowledge that you shared with us today.
We applaud you.
Yes, thank you so much. I love it. What a great idea.
Thank you.
And I will be sending a follow-up email to everybody today for participating, and I will share with you Suburban Geriatrics information if you wish to seek out, perhaps see Rob as a patient. You've had the opportunity to meet him and get to know him a little bit on a personal and a professional level. So we would love for you to maybe utilize him as a resource in the future. And we thank you for joining us. And we'll make sure on our next coffee chat, we'll have a little more time for you to ask questions to Elder Care Attorney Rob Slutsky. I want to be cognizant of everybody's time, though. We are running a little bit later. I'm going to let Dr. Pearlstein hop off in a minute, and also Elder Care Attorney Rob Slutsky. And then if anybody else wants to stay on and have a little bit of conversation and share some of the services they provide, I'm happy to stay on a little bit longer for those of you who have.
Heather, I just wanted to say one thing.
Yes.
For all of you who don't know Rob, I've known him for well over 20 years. Him and his practice have been invaluable to me as an elder law attorney. Whenever I need an assessment done, they bend over backwards. They go to people's houses. They make appointments. They are the most accommodating, cooperative, helpful medical group on the face of the earth. And to our benefit, they're enormous. They have, how many docs do you have now?
14 docs, 30 nurse practitioners.
So
what is their website?
So they are available to help you as professionals, and they do help you. They are, again, the most accommodating medical practice that I've ever seen in my life. So I just wanted to give my little feelings, because Rob has been so helpful to me over the years.
I appreciate
their website.
We'll make sure that you have the contact information.
Thank you, Heather.
Suburban Geriatrics.
Sure, my pleasure.
SuburbanGeriatrics.com.
All right, everybody. Have a great day. Any questions?
See you later, Rob.
Thank you. And those of you who would like to stay on, feel free to stay on, and we'll let those of you who have to leave. Thank you again for joining us today.
Thank you.
I'll
I'll
have to
stay
go to another
on.
appointment, but have a great day, everybody. It's good to see everybody, and Happy New Year.
Thank you.
Happy New Year.